let's break down this great visual abstract created by the APSA Education Committee. So why do we repair undescended testicles? Why not just leave them alone? Well, the first reason is for fertility preservation. Studies have demonstrated that undescended testicles do demonstrate impaired spermatogenesis. The second reason is that undescended testicles are associated with a higher risk of testicular cancer. While overall rates are still low, they are about 4 to 7 times higher than the general population. An important point to discuss with parents is that orchiopexy does not eliminate the risk for testicular cancer. However, it does allow for self-examination and earlier detection. It's not uncommon to see young babies, particularly premature babies, with undescended testicles. However, if the testis is not descended by 6 months of age, then orchiopexy is recommended. One important consideration is if there is an associated inguinal hernia along with the undescended testicle. In these situations, earlier intervention may be considered, but the bottom line is that orchiopexy must be done at the same time as the inguinal hernia repair, as the testicle may become entrapped in place after the hernia repair. If the patient is older than 12 months, then elective repair is recommended as soon as possible. The treatment for undescended testicle is surgical orchiopexy. Hormonal therapy has not been considered effective and is not routinely recommended for the treatment of undescended testicles. The repair approach is dependent on a good physical exam, namely if the testicle is palpable or non-palpable. There is no role for ultrasound in determining the location of an undescended testicle. Ultrasound is notoriously unreliable and cannot determine with certainty the testicular location or even if a testis is absent. If the testis is palpable, then a standard inguinal incision can be made. If the testis is not palpable, then laparoscopy can be done to assess the location of the testes. The next decision is to determine if the testicle can reach the scrotum. If it can reach, then a one-stage orchiopexy can be performed. If it cannot reach, then the gonadal vessels may be ligated and a two-stage orchiopexy may be carried out. Some special considerations include, what would you do if there were bilateral non-palpable testes? In this situation, one would have to consider the possibility of anorchia, renal agenesis, or even DSD. Further evaluation is required with labs as well as renal ultrasound. What about if you encounter an atrophic testicle with short vessels and/or appears dysmorphic? In these situations, orchiectomy is recommended. And finally, what if you are looking laparoscopically and identify the gonadal vessels going through the internal ring, but no vas deferens? Absence of a vas deferens has been associated with both renal agenesis and cystic fibrosis, and so evaluation for these conditions should be considered. Thank you again to the APSA Education Committee.